pa namang 6 o'clock. So, good afternoon po. I'm Dr. Ana York Bondoc. Thanks for joining our Libreng Consulta today. And we are live on YouTube and Facebook. Please follow us, like po, share sa mga nagtatanong. And our topic today po is very interesting. These are the new drugs po that are available na po for COVID. So, alamin niyo po at makinig kasi baka ho makatulong yung mga drugs na yon sa inyo. All right? So, let's start po. By the way, I invite everybody, since libreng konsulta po ito, please put your questions po down below. We will try our best sa daanan po lahat ng tanong, but sometimes may time constraint talaga, pero susubukan po namin. All right? Yung nagpapabati ng happy birthday, ilagay nyo rin. All right. Thank you so much. I hope everyone's okay. And I hope that everyone is taking the proper precautions. So mag-start na po tayo. Ang title po natin is ang bagong gamot po ng COVID. Alamin po natin sila. Ayan.
Letter A. What are the new drugs for anti-COVID?
Okay, I wanted to talk about two drugs. This is molnupiravir and Paxlovid. So, can you flash lang po the name of the first drug? Yung molnupiravir po, napag-usapan na po natin yan, ano? This is a new antiviral drug po by Merck, no? So, ano po yan? Wait lang po, no? Yes, this is by Merck, M-E-R-C-K, no? Produced po by Merck. This is an antiviral drug po. It is oral. It's taken for for people na diagnose po with COVID within 5 days. So the moment po people are symptomatic, they have to take po molnupiravir. Iniinom po siya by mouth. It is now available po in the Philippines. We have to credit po Mayor Isko Moreno. Marami pong binili for the city of Manila. And I heard that he was advised by Dr. Willie Ong. So good job po. And for the DOH, we now have molnupiravir which is available po. Last November, dumating na po ito and it received an emergency use authorization po from our FDA. So, yan po. That's the new drug. It's called, paki-flash na lang ulit, molnupiravir. Okay? How to pronounce molnupiravir? Para hindi naman po kayo mapahiya sa doktor. Okay? And the second drug, so wala pa po tayo sa P. Our second drug po is by Pfizer. It is a combination drug po called Paxlovid. I think I asked you to, ayan. It consists of two drugs po. Can you just type Paxlovid alone and the two drugs po separately? Kasi masyado pong maliit. Nobody can read it on the screen. So, ano po ito? This is a combination drug po, no? Of two older drugs. Yung ritonavir po is, yan, Paxlovid po yan by Pfizer. It's made by Pfizer. Okay? And, ayan po, combination drug. Tinatype pa lang ho siguro yung kanilang, So, Paxlovid, no? It's a combination drug po. Two drugs in one tablet. So, two generic antiviral drugs po in one tablet. And the first drug po is called nirmatrelvir and ritonavir. Ang ritonavir po, kilala po yan as an HIV drug. Ano? Talagang HIV drug po yung ritonavir. And together po, they are undergoing trials for COVID-19 patients. So right now po, sinasabi po that molnupiravir will reduce by 30% the risk of death and hospitalization po for yung mga seniors, comorbids, and those at very high risk. Dati po, the molnupiravir was almost known as a wonder drug, pero ngayon po, we're starting to get more realistic and mukhang 30% lang po. Ito pong Paxlovid, still under study pa po, but reportedly to be very effective. More news upon this, yung Bexovid po or the generic form po of Paxlovid was approved 2 days ago. So, na-approve po yung generic form of Paxlovid po sa Pilipinas. Okay, next po. So, yun po yung dalawa. There are some other new drugs, but wag na po natin pag-usapan since they are not yet available in the Philippines. Okay, next. Ayan po, that is one of the other drugs that are coming out pero not available po ito sa Pilipinas as of the moment. So, next po.
Letter
Okay.
D. Hindi po ba paracetamol ngayon ang binibigay and cough syrup?
Okay, you guys, this is a very, very valid question po, no? Kasi people are surprised. Sabi nila, how come I'm getting questions like, Doktora, are we treating po the COVID with paracetamol and the cough syrup? Ang sagot ko po is no. What is COVID? COVID po is a virus. So the way to treat it is with an antiviral drug. Ngayon po, ito pong molnupiravir at saka po yung Paxlovid, those are antiviral drugs. And in fact, their mode of action po, ginugulo po nila, no? They destroy the replication. Yung iba naman po, they destroy po yung ano po, structure talaga ng virus. So kuminsan hindi na po siya makareplicate, and as we always talk about, no, a virus needs to replicate po within the host. So ginugulo po nila yung cycle, life cycle of the virus, yun po, no? Why are we taking paracetamol? Why are we taking decongestants? And why are we taking cough syrup? Hindi po yan ang antiviral. We are taking that po to relieve the symptoms. Para yung mga simptomas po na dulot po ng virus sa ating katawan. Like fever, mas mataas po sa 38 or 38.5. Officially po, 38.5 is considered yun po yung sa ospital na talagang danger. Hindi naman danger, but we consider 38.5 to be a fever. Yung iba po, sinat lang. So, we give paracetamol to bring down the fever po of the patient. Yung tao po na may COVID ay nagkakalagnat po because that is the body's way po of reacting to the virus. So we are actually treating the fever and not the virus. Okay? Why are we giving cough medicine? Kasi po, when the virus lodges po in our respiratory tract, and then dito po, yung iba, yung delta, pababa po sa baga, there becomes inflammation. Yung inflammation na po yun can cause coughing and irritation. Tapos po, nagkakaroon na sipon, nag-causing cough din po, phlegm and mucus. We try to expel po that. And that is why we cough. So, nagbibigay po tayo ng anti-cough or cough medicine. Hindi, again, that will not kill the COVID po, no? It will only stop you from coughing. Kasi masakit hong umuubo ng umuubo. But essentially, ang pumapatay po talaga sa COVID is the immunity po, the antibodies, the T cells, and the B cells na working together po, pinapatay po nila yung COVID sa katawan natin. So basically, katawan pa rin ho ng tao ang pumapatay po ng virus. So I went to the paracetamol, the anti-cough, the decongestant, para maluwag po yung ating hininga. But these are over-the-counter drugs that are meant to relieve symptoms of COVID and reactions of the body to COVID. Okay? Hindi po siya talaga, like paracetamol will not kill COVID po sa katawan natin. Ikaklaro ko lang po yan because that is a very, very common thought po ng mga tao ngayon. That we are taking these drugs to kill the virus, but actually not. We are taking these drugs to reduce yung masakit na symptoms po, no? Sakit ng katawan, paracetamol, fever, paracetamol, cough medicine, and barado po and tumutulong sipon with the decongestants po and expectorants para lumabas po. Okay? Luminaw ba yon, Renz? Kasi marami talaga nagtatanong yan.
Actually, Doktora, salamat sa paglinaw po nito. Sabi nga po, marami talagang ngayon ang perception nila is, naku, biogesic lang yan, bioflu lang yan, kaya nga nagkakaubusan. Kasi yun lang pala ang gamot sa COVID. Tama po si Doktora, bilang nurse po, ang term po namin sa ginagawa pong treatment sa inyo is management care. Ibig sabihin, minamanage po yung
symptoms, yung
nararamdaman nyo.
Oo.
Yes. Not directly the cause itself. Kasi mas malalim pa pong usapin po yun.
Okay. All right.
Next po, letter. Okay, sandali lang po. Ito po, letter C. Available na po ba sa Pilipinas?
Yes, actually, this is very interesting. Let's talk about the two drugs, no? Yung molnupiravir po, I've seen it already na ginagamit po ng mga kaklase ko po na mga doktor. They have already prescribed it. It's available in NKI po. And you will need po a doctor's prescription and you have to sign po na you fit the criteria po for that. So pupuntahan po natin yan. It is available. Si Mayor Isko nga, as I mentioned, bought a lot for the City of Manila. Thank you, Mayor Isko. And nag-grant po siya ng emergency use authorization ng ating pong FDA. Yung Paxlovid po naman, 2 days ago, na-approve na po yung generic version. So within a few days po, or as soon as possible na po, darating na po yan, the bigger bulk po. So yes, it's available in the Philippines. Kaya lang, sige, I think some of the questions will answer more of that.
Letter D, who should use these drugs and kailan dapat?
Napakaganda pong tanong yan, ano? Because kung nilagnat ka, then you feel like you have COVID, susugod ka na sa ano, no, please. These are only given under the supervision po of a doctor. Number 2, hindi po lahat ng tao binibigyan kasi these are only effective or found to be effective for the seniors, the vulnerable, and yung maraming sakit. For example, if you are 67 years old, maybe you have asthma and diabetes, and then you became COVID positive, then you should approach your doctor and inquire po about molnupiravir kasi nakakatulong po yan. Timing po ng pagbigay po ng molnupiravir is within 5 days po ng simptomas. So you have to do it early. So kaya nga sinasabi namin, if you are a senior, comorbids, or marami pong sakit, then you may do good po with molnupiravir. So, who should use these drugs? The seniors, the vulnerable, yung maraming sakit na positive. And again, you need a positive PCR test. Hindi po kung sino-sino lang na inuubo, susugod po doon and demand, Yung NKTI po right now, they're giving out molnupiravir. Isiniscreen po nila muna mabuti with the doctor's prescription at saka po yung description ng pasyente. Hindi po pwedeng 25 years old ka, bibili ka ng molnupiravir unless, for example, you're a 25-year-old cancer patient on chemotherapy. Naintindihan ko po yun. So, it's very tight use, prescription of doctor, compassionate use, you have to sign something po talaga, no? So, hindi lang po dapat. Not everybody can purchase. And then, kailan dapat? Early. Within the first 5 days, you have to take it po. It is an oral, iniinom.
Letter E, saan po nabibili ito?
It is available sa province po, nabigyan po yung namin yung isang empleyado namin. It's available naman po sa mga ospital. In here, it's available sa Asian, sa NKTI, sa iba't ibang hospital po, no? But you have to apply. Your doctor has to send a prescription. And kailangan po, you have to be senior nga, maraming sakit. Yung nahuhulog po kayo dun sa kategoryang yon. It is not available for everyone. Parang naputol po. So, ayan. Balita ko po sa molnupiravir was 3,000 for 5 days. Okay? So, ang alam ko, binabaan po nila yung presyo in the Philippines. Okay?
Okay. Let's go to the questions na, Doktora. Live questions. From Miss Cathy Rodriguez.
Wait lang so basically, wait lang. So what's our take, no? Meron pong mga bagong drugs. They are available na po. Ang pinaka-widely po yung molnupiravir. They are available through your doctor. If you are a senior and you become positive, please inquire about this. Okay? And mukhang affordable naman po. I wouldn't say it's cheap, but mukhang affordable naman po. Okay?
From Miss Cathy Rodriguez, Doc, will molnupiravir work on virus variants, including Delta and Omicron?
Ma'am Cathy, thank you for this excellent question. Well, it was primarily tested po on the Delta variant kasi it was developed po ng mid of last year. Though it is an old, na-develop po siya for SARS-CoV and then parang the first SARS. So they see it now as being possible na rin po, no? I would say na test siya on the Delta and siguro po I can't tell you that it's ano ho, the initial balita was 50% reduction in hospitalization and death. So napakalaki po noon, biro mo, if your chance of getting hospitalized mataas, kalahati na lang. Pero as they went through the clinical trials, naging 30% na lang po yung reduction in hospitalization and death. But that's still good. Kasi, so dapat po talaga, you should be vaccinated para yung risk mo, binabaan na ng bakuna. Tapos, kung senior ka, uminom ka ng molnupiravir, mas lalo pang bababa yung risk mo.
Okay, from Miss Elizabeth Reyusora, good PM po, Doc Ana. Ask ko lang, ano po kaya ang magandang gamot po sa sakit ng ulo? After ko po magkatrangkaso, 1 linggo na pong di nawawala ang sakit ng ulo.
Ma'am, I would I would try and take paracetamol po. That's really used for headache and then you might try mefenamic acid and yung mga NSAIDs. Pero talagang if you're not getting better, ma'am, it is time to get a checkup. Kasi hindi po natin alam ngayon kung panahon po ng Omicron, kung trangkaso po ba talaga yung tumama sa inyo or whether you're starting to develop other issues related to COVID. Kasi ang COVID po, no, there is what we call long COVID. Yun po yung persistent symptoms. So, hintayin po natin yun. If you get better within a week, that would be good. Kung hindi po, it's time to consult your doctor na rin. So, I would say paracetamol po and mga headache medicine. And if not getting better, proceed na po talaga sa doktor. Okay?
From Mr. Jason Silaran, Doc, ask ko lang po, tingin niyo po, yung gamot na yan kaya is qualified sa lahat ng variants? Ano po ba yung ginagawa exactly ng Paxlovid or Bexovid molnupiravir sa katawan natin? Salamat po, Doc. God bless.
Sir Jason, this is an excellent question and it looks naman po that it's quite effective against various variants. Though yung Omicron talaga, hindi naman po talaga masyadong mataas yung hospitalization risk. So, I guess it's still okay naman, no? As I mentioned, it was developed last year, so na-test po siya talaga primarily, I would say, on the Delta variant. Kasi wala pang Omicron noon. Omicron only appeared na tong November, December po, no? So what exactly does it do? It stops ginugulo po nila through various mechanisms. Ginugulo po nila yung DNA and RNA po ng virus. So, hindi po siya makarami sa katawan. So, talagang antiviral po siha talaga. Unlike paracetamol, cough syrup, and decongestants, which are symptom relief. Pampaluwag po ng pakiramdam po habang linalabanan ng sarili nating katawan, antibodies, white blood cells, yung virus.
Well, good job sa ating katawan, Doktora. Yun po ang aking masasabi.
Kailangan malakas sa katawan mo.
Okay, next question po from Mr. Chad or Miss Chad Casillan. Doc, paano makaka-avail or ano ang procedure para makakuha? I think she or he is referring dun sa mga gamot po, Doktora.
Yes, okay. Ito po yun, I talked to a lot of my classmates also. Ganito po yun. First of all, you have to be a senior. You have to be with comorbidities. Hindi po pwedeng wala yun. It's screened. And then siguro, it would also, if you are non-vaccinated senior, baka mas lalong kailangan mo versus the vaccinated. Okay. Number 2, it should be given within 5 days po na may nararamdaman. Number 3, you need a positive antigen or swab test. Hindi po pwedeng tumulo yung sipon, sumugod ka na doon. Hindi po. We need to document that you are really sick of COVID. Kasi meron naman pong regular lang po na trangkaso. Number 4, it is only given po with the prescription of a doctor. And your doctor will advise you po. Kasi sa iba't iba pong probinsya, iba't iba po yung nakalagay. I do not know if it's available already in Mercury. Pero dito po sa Manila, what I heard is NKTI, Asian, St. Luke's. So, and then you can go home po after taking that. So, most likely po, you consult your doctor. The doctor po is affiliated with various hospitals. They will give you a prescription. And there is a form that you need to sign po from the DOH.
From Miss Susan Marquez, Doc, nag-negative po ang anak ko sa swab test pero may ubo pa po siya at medyo hirap huminga. Ano po ang pwedeng gawin?
Mom, this is why I don't like testing, okay? I'm not angry at those who tested, pero I just want everybody to be aware na yung test po, ma'am, marami pong nakakalusot na Omicron. Ang Omicron po is not picked up, lalo na po by the antigen test. What does that mean? Pwede pong antigen negative po yung pasyente. Pero talagang, Diyos ko, ubo ng ubo, tumutulo na yung sipon, yung 39. Tapos, hinawaan na niya lahat ng ibang tao sa bahay niya. So, what I'm trying to tell you is there is less reliance on testing and more reliance po on clinical eye. Kung talagang, na positive yung kasambahay mo, tumutulo na yung sipon mo, yung talagang may symptoms ka, but you have a negative test, then I would still treat you as COVID and still isolate you po. So what should you do? You should take po cough medicine. You should take symptomatic relief po, paracetamol, decongestants, and see how that works for you. If you are not getting better po, then you should talk to your doctor. By the way, sandali kung senior po yung swab negative, pero mukha-mukha talagang COVID, kausapin niyo pong masinsinan ng doktor nyo because we will either repeat the swab test or in a few days para mabigyan po kayo ng molnupiravir.
From Miss Catherine Villaga, good PM po, Doc. Yung 17-year-old daughter, nagkasipon po siya nung last Tuesday, tapos nag-uubo po siya. Paminsan-minsan lang naman. Andito po ako sa Quezon City, nasa San Mateo, Rizal po siya. Nagsinat lang po siya nung Tuesday, pero ngayon di na po.
Okay, so ano po yung tanong nyo po? Did I miss the question?
No, Doktora, parang
nagkikwento lang, okay. Oh, that's okay, ma'am. Sorry, I thought baka because I looked down, baka I didn't get what to get eh. Ma'am, ganito po yon. Yung sinat-sinat po, no? I mean, people find it really hard. Marami po talagang nagagalit pag sinasabing possibly high probability po talaga na COVID po yon. What you should do po for daughter is isolate po yung daughter nyo, yung mga kasama niya po sa bahay, also isolate, advise them po na no need to test unless getting worse. Kung bakunado naman po si daughter, I hope bakunado po si daughter, that's another protection. And then just stay at home po, take the over-the-counter ho na binanggit ko, yung mga cough medicine, paracetamol, decongestant, inom na inom lang po ng tubig, fruits, lakasan ng kain. Yun po yun, and after 10 days, that should be okay. Ngayon, kung getting worse po talaga, and of course, you would like to monitor po with a pulse oximeter, yung nasa daliri po para malaman natin yung oxygen. Ngayon po, if not getting better, then that's the time po to consult a doctor and to get a test. Okay? So, I'm praying and hoping po na si daughter will recover. Bata pa yun, most likely po yung mga kids, they're gonna do well. Okay?
From Miss Kathy Rodriguez, good morning po, Doktora Ana. How long are you gonna be contagious after contracting COVID? And how long it takes for the COVID booster to effect? 1 week or 2 weeks? Done with my booster shot 6 days ago. Thanks, Doc.
Thank you, Ma'am Cathy, and congratulations po on your booster shot. Good job. So, eto po yun, for the booster shot, it's like the COVID shots din po. The COVID, sinasabi po nilang COVID vaccines, sinasabi po nila 2 weeks after the second dose. So, ako wala naman I don't really have the data, no? Pero I would say po 2 weeks after the third dose would be very good, na po, no? And then, how long are you contagious? Nagpalabas lang po this morning ang DOH kung kayo po ay positive or symptomatic, 10 days po. No? 10 days. Again, there is no need to retest po after 10 days. So, pwede na po kayong lumabas ng quarantine after 10 days and you should be okay.
From Miss Catherine Villaga Tulod, paano po makakabili po ng mga gamot?
First of all, no, yung mga symptomatic for symptom relief, paracetamol, decongestants and cough medicine, available po yan sa Mercury, sa mga Watsons, ganon, pharmacies, ano? South Star Drug, para banggitin natin yung lahat ng pangalan para hindi naman sabihin na pinaburan ko yung iba. But again, no, those are not the anti-COVID. These anti-COVID pills, inexplain ko na po. You have to get them po with the prescription of the doctor. You will also sign po a paper for compassionate use. And i-screen po kayo kung nahuhulog po kayo dun sa grupo po na dapat pong makatanggap ng molnupiravir. These are the seniors, the highly vulnerable, those with many diseases. And siguro, idagdag na po natin yung hindi po bakunado kasi yun po sila po ang possible na maging serious. So if you're not vaccinated, consult your doctor din po, lalo na if you are senior and non-vaccinated and may na positive sa inyo and now tumutuloy yung sipon mo, consult na po your doctor talaga. So only from a doctor po talaga. Ang nakalagay po, no, sorry, I wanted to add, no, sa the medical city, the only persons who can prescribe molnupiravir are infectious disease and pulmonologists. Okay? So those are the two kinds of doctors, infectious disease and pulmonary. Hindi po pwedeng yung OB-GYN ninyo magbibigay ng molnupiravir or yung Cirojano. Okay, so it's very, very restricted. Kasi meron din po mga side effects yan at hindi po natin dapat inumin unless it is necessary po for us.
From Miss Hilda Garcia, kudos po, Yorme, for purchasing and helping out those afflicted with COVID-19. Also, Doc, ang galing po nila. Yan talaga dapat i-prioritize. Nakita ko lang sa page nila na namimigay sila ng molnupiravir basta may reseta or PCR test.
Ma'am Hilda, that is good. We would like to congratulate nga po si Dr. Willie and si Mayor Isko for purchasing a large amount po of molnupiravir. Wala pa pong surge. But again, don't panic, guys. Ito lang ang gusto ko iklaro. Kung bata pa po kayo, bakunado kayo, you are healthy. That's a lot. Ito, Reyna, ha, did you know that 50% of the Philippines population is actually below the age of 25? So, konti lang po talaga yung mga seniors ng Pilipinas. So, don't worry po. Don't panic if you're not drinking this drug. If you are vaccinated, if you're okay, you feel mild lang, gano'n, don't panic. Huwag po kayo matakot at mag-demand kayo. Hindi kayo bibigyan dahil hindi po kayo talaga dapat para rito. Okay? So, there is no need, ikaklaro ko lang there is no need to panic if you are young, you feel well, kayo po ay bakunado, mild lang, you do not need molnupiravir, okay? You do not need molnupiravir. Ngayon, kung na-positive yung lola at lolo nyo and nakadialysis siya, then that's another issue. Mag-usap po muna kayo ng doktor, okay? So I don't wanna panic anyone that couldn't get the drug, malayo sa pharmacy, ganun. Huwag po kayong matakot. You'll do good, okay?
Hello po, from Miss Lita Getes Acantilado. Hello po. Tanong ko lang po kung yung pasyente na merong MDR-TB na nag-positive sa COVID-19, maaari ding mag-positive ulit sa second swab test niya kasi nga meron siyang sakit sa baga.
Okay, biglang naintindihan ko na po ito. Ma'am, what is MDR-TB? First of all, that's tuberculosis. Ano po? MDR is multiply drug resistant. So this is a very, very serious illness po. At ang meaning po nito ay hindi po tinatablan ang inyong tuberculosis na mga regular na gamot. gamutan po talaga is 3 to 4 drug regimen. Pag hindi na po, if you are MDR, what is the meaning of multiple drug resistant? Ang meaning nun, hindi na po tinatablan ng gamot. So basically, there are very few drugs, no? So you need special drugs for TB. Okay, so na positive si MDR TB, malaking problema po yun because you're already having TB and then you have to deal with COVID. So pag ubo mo, you're not only coughing out TB, pero kung naka-drugs ka naman, hindi ka naman uubo ng TB, okay? If you are being treated, that's okay. But this is a double problem kasi you have two problems in your lungs. COVID and TB. Okay. So nagpa-swab ka, positive ka. Okay. So there's a second swab. I'm just thinking na baka po 14 days kaya nagpa-COVID swab or 10 days. Okay. Yes, it is possible po na maging positive po yung second swab nyo. Hindi po, yung positivity niya is not related to the MDR-TB. Wala pong relasyon si TB sa swab. Ang sinaswab po si Kuya COVID. Okay? COVID. So, yes, it is possible to be positive po yung second swab because yung napipick up po doon, kahit 14 days na po ang nakalipas, is yung remnants, yung tinatawag pong remnants of dead COVID. So, nagiging positive po kayo kasi yung patay po na COVID sa inyong dugo ay napipick up po ng test. Okay? Did you get that, Reina?
Yes, Doc. Ako po, malinaw po sa akin.
Oo, nagiging positive po. Tanggalin natin yung kwento ni MDR-TB. It's not related to the swab, okay? So, you got swabbed once. Okay, positive. And then, nag-quarantine ka. Then, you got swabbed the second time. Magpa-positive po yun, not because you still have COVID, and totally not because of TB, but because meron kang patay na COVID na umiikot sa katawan mo pa. It takes time. People can remain positive po for up to 6 months after their COVID, after being cured of their COVID.
Okay, that's very clear, Doktora. Next question po. Good afternoon for Miss Maribel Villanueva. Good afternoon, Doc. May rheumatoid heart disease po ako. Pwede po ba akong magpa-vaccine?
Ma'am, hindi lang po kayo pwedeng mapag-vaccine, but you should be vaccinated because if you get COVID po with rheumatic heart and mga valvular problems po that come with the rheumatic heart disease, you are at a high risk po for getting serious COVID. Okay? So my advice to you is get vaccinated ASAP na po. And kung nagkakaroon po ng nervyos, wala naman pong masama. It is okay to get a check-up po para bumaba po yung nervyos at kaba ninyo. But if you wanna go diretso na po, pwede na rin ho kayong dumiretso, okay? Ito lang for those with comorbidities na hindi pa po nagpabakuna, like high blood, like asthma, like diabetes, it is very dangerous po sa inyo ngayong surge na to. So please, I'm begging you, go to the vaccine center na po as soon as possible.
From Mr. Paul Carlos, are they available sa mga drugstore? They are, I think Mr. Paul Carlos is referring to the
yes, yung mga opo.
Papayagan po
opo, at saka relatives. Pwede naman po from relatives from abroad. I do not know po yung policy po sa ibang bansa. But what I would know, having practice po sa US, these kinds of things are also by prescription only. So the relatives, they cannot go po to the pharmacy and just buy. Ako personally, I do not know if it is available in Mercury. Pero yung usapin po namin ng mga kaklase namin at mga forms na pinakita po sa Viber, these are available po through the hospital. And as I mentioned po, like sa Asian Hospital, nakalimit lang po sa infectious disease at sa pulmonary. I do not know po if it is I think different hospitals, what I'm trying to say is, I think different hospitals have different policies. So eventually po, I think pati mga general practitioners will be able to prescribe these drugs. Pero at the moment po, medyo strict pa rin ho yung criteria. Sinabi po ng kaklase ko who works at NKI this morning, marami pong na-turn away from NKI because they did not meet the criteria.
From Miss Eugenia Balington, Kabungkal, azithromycin makakatulong po ba?
Okay. Number one and best question of the day yan, ma'am. Okay. question at ibabatok sa inyo ha, at sagutin nyo to. Azithromycin or Zithromax is a ano po, it's a antibacterial, so what we call po an antibiotic. Okay? So my question to everybody, kailangan ba na antibiotics sa paggamot ng COVID? Ikaw, Reyna.
Ako, Doc, not directly to COVID. I think they are giving the antibiotics because we already have, as a human being, kasi may mga bacteria tayo sa katawan. May yung possible yan na nakakain natin, etc. Now, those bacteria are idle. Kumbaga, hindi pa nila kaya yung katawan kasi may immunity pa tayo. But then, bacteria plus virus versus your immunity, babagsak yung immunity mo once na may virus ka. So, yung bacteria, sugod tayo. That's why many doctors are prescribing agad, lalo na yung mga possible magkaroon ng pneumonia. Nagbibigay agad sila ng antibiotics. I'm not sure if that is correct, Doktora.
That is a good answer, Reina. And that is the principle of the flu. Okay? Tama po yan. Okay? So, let's himay the tama ka, Reina. That is a very good answer. And that is how the flu kills people, okay? The flu is a virus. Ngayon, the flu will invade the person's body, lalo na kung elderly nga, sabi natin comorbidities, ganon, bababa ang immunity niya. Sa pagkababa ng immunity niya, yung bacterial pneumonia papasok. At yun ang pumapatay ng tao. People do not really die of quote-unquote flu. They die of the bacterial pneumonia that will occur. It's a secondary infection while you are recovering from the flu. So may point ka doon. Okay? Pero may isa pa pang point. Sa akin, if you have a mild infection, mukhang okay ka lang. Bakunado ka nga, as I said, and you are young, we do not, this is the reason why I don't prescribe antibiotics dire-diretso. Nung wala pang COVID nung wala pang COVID, okay? Kasi there are so many common cold viruses, trangkaso viruses, hindi lang po COVID eh. So, as a doctor, we were always trained na likely it's viral and don't give antibiotics kaagad kasi kung diretsong antibiotics po ang ibibigay nyo, na hindi naman po talaga actually kailangan po ng tao, magkakaroon po ng antibiotic resistance or masasanay po yung mga bacteria and next time bigyan mo ng antibiotic, hindi natatabla. But, so that's the reason why I do not start, nung wala pang COVID, that's the reason why I do not start antibiotics immediately pag may inubo. Kasi likely viral and it will not work versus the virus. Okay, this is very strong sa children. Ang mga pedya, I don't know if you noticed that, Reina, ang mga pedya talaga mas mahinang magbigay ng antibiotics kaysa sa mga adults. Kasi majority ng tumatama talaga na ubos ng mga bata ngayon and even before is viral. So strictly, if you ask me, if as a pulmonologist, if someone came in po with really COVID symptoms, I wouldn't start antibiotics immediately. Pero, kasi viral yun eh. Tsaka kung nag-positive pa, di mas lalong viral yun. Pero, for example, nagpe-persist yung ubo, gumagrabe po, the lagnat is getting to be 39, yelo na po ang dinudura, then I might start po antibiotics. So azithromycin and other antibiotics are not meant to treat the virus itself, but sometimes they are meant to treat the bacterial infections that may occur after bumaba po yung immunity nyo with the virus. So tama yung sagot mo, Reina, and congratulations. That was a well thought out answer.
Okay, would you want us to continue further, Doktora? Or last
so wait, my question lang, marami pa bang tanong?
Doktora, as usual, inuulan tayo ulit ng tanong at wag po sanang tampo yung 103 viewers natin, Doktora. Hello po sa inyo.
Okay. So, sige, let's do 2 questions. Try to
Okay,
choose 2 na medyo hindi pa natatanong o medyo iba ang
sige
dating,
po.
ganon. Para
Ito, Doc,
maano.
from Miss Cathy Rodriguez. What is monoclonal antibody treatment?
Maganda po yung tanong na yan, okay? What are monoclonal antibodies? Monoclonal antibodies, di ba? These are antibodies that are made in the lab. They are not antibodies that were formed in the body. Kumbaga, gumagawa po sila ng antibodies sa lab and ini-inject muna sa katawan habang we are waiting for the antibodies formed by the body to regenerate. This is the principle of rabies. Sa rabies, when you get bitten, you get the vaccine and the antibodies. Dalawa yung nakukuha mo. Para yung antibody na i-inject sa'yo, agad-agad aawayin na niya yung rabies. While your body is reacting to the vaccine. Okay? So, yes, there are monoclonal antibodies which I i-inject sa'yo. This is mostly available in the US. Wala pa po talaga sa Pilipinas. And ito po yung ginamit po ni President Trump. Nung siya po ay nagkaroon po ng COVID. He was injected po with monoclonal antibodies po for COVID. So, ano po ito, no? So, mostly available po ito sa US and not yet po sa Pilipinas. At least I have not heard pa po, no? Mga kakaiba po ito, mga casirivimab, indevimab. Hindi, wait, sorry. Wrong answer. There are some people, now I'm remembering, there are some people po who imported po some monoclonal antibodies po dito sa I remember na merong tiga merong tiga UP College of Medicine, no? Na nag-import po ng some monoclonal antibodies. Pero sa Pilipinas po, it is not commonly used. Sa US po, they tend to use more of that.
Okay, for our last question, sandali lang po, Doc.
Okay.
Doc, ito po, from Miss Beleza Fe. Ask lang po, when is the right time para magpa-booster? I just completed my 10 days from my COVID-19 positive mild symptoms.
Okay. Ang ganda po ng tanong na to. So, and everybody wants to know this, if you have recovered from COVID or COVID-like symptoms and you feel totally okay, nakalipas na po yung inyong quarantine na period nyo po, 10 days, no? Pwede na po kayo on day 11 if you feel completely okay, nagtatawag na po yung barangay, you can go na po on day 11. If you would like to wait a few days, okay na po. But you need to be completely symptom-free. Hindi kayo inuubo, hindi kayo linalagnat, walang sinat, malakas ang katawan, kumakain, naglalakad, tumatalon, even better. It's okay na po to get your booster shot. And don't worry po, kasi by getting COVID, para ka na ring, you develop antibodies, natural antibodies po to COVID. So, nakatulong na po yon. Okay? But, still get your booster shot pa rin po. Kasi iba po yung na-form ng katawan yung antibodies with COVID at iba po yung na-form na antibodies. They are different kinds of antibodies. Magko-combine po sila to protect you in the future. Ayan.
I guess, Doc, that's all that we have for today po.
Okay, so to everyone po, I'd like to invite everyone. We're gonna have another topic naman po, which is breastfeeding po tomorrow. We'll try to do it po at 11 a.m. Kung hindi po kami dumating na 11, usually sa hapon na po. The question that we're gonna tackle po is how to increase your milk supply when you are a breastfeeding mommy. Okay? And the question po na linagay namin is true or false, yung pagpapump po kung konti lang, does it mean that you'll never feed your baby? So sasagutin ko po 'yon and other myths about breastfeeding po, no? So to everyone, kasi nag-break lang po tayo sa COVID kasi everyday COVID na lang. Marami pa naman hong ibang problema sa mundo other than COVID, but truly po there is a surge going on. So I'd like to tell everyone na kung kayo po ay may simptomas na mild o kayo po ay na-expose, naging close contact, the first step is isolate. The second step po is to decide if you need testing. Kung bata pa po kayo, ako, ito sabihin ko, no? There was somebody who got fever po in our house. We didn't test. We just isolated. No need na po. Basta, you isolate. Okay? So, it was published na po this morning in the Manila Bulletin by Dr. Edsel Salvana. Kasi po talagang, mo, Reyna, 1 million a day. We cannot sustain that sa US. Mauubos ang test kits ng Pilipinas. So don't test unless you're a senior. I mean, I don't say don't test. You are not rushing, don't need to rush to test unless you are a senior, unless you have many comorbidities, or unless nag-isolate ka na and hindi ka gumagaling. Okay? So to everyone, yes, there are new drugs. They're available through your doctor. If you're elderly and you got positive, or you have many sakits and you got positive, please consult your doctor and they will assist you po to get these drugs na available po ngayon sa Pilipinas. Thank you so much and good evening.